Israel had one of the world's fastest vaccination campaigns. Over 60% of the population is fully inoculated. But then came the Delta variant, and now emergency wards are starting to fill up again. The health ministry says a fresh round of vaccination is needed to keep the new strain at bay.
Therefore, those who received the vaccine 5 or 6 months ago need to get a third dose. And without a third dose, they are far less protected. And this is what we are doing now. We are the first in the world to do this.
Once again, Israel is forging ahead, and their success or failure will provide valuable data to the rest of the world working to contain the Delta strain. This is your COVID-19 special here on DW. I'm Janelle Dumalaon. Most Israelis living in one of the most vaccinated countries on the planet thought the worst of COVID-19 was behind them. But now the fourth wave has come, forcing COVID wards back into action.
The medical staff at Tel Aviv's Ichilov hospital are back in crisis mode. Nurse Iman shows us around the intensive care unit for COVID-19 patients. The ward had to be reopened a month ago. It is at full capacity again as the Delta variant plunges Israel deep into a fourth wave. The isolation ward is a stark reminder that the pandemic is far from over. It goes without saying, it takes a lot out of us. It's not a regular ward. It's difficult with all the seriously ill patients. You need to be able to deal with it.
It's very upsetting. I was hoping that we wouldn't get back to this. I just started working in the hospital a month and a half ago, but I really wanted to work in the corona ward and be part of it.
A majority of the seriously ill patients on this COVID-19 ward have not been vaccinated. Some have been inoculated but still got infected. Here it's mostly elderly people. Back outside, we meet Dr. Tashbina. The vaccines work and are vitally important, he says. Without them, more people would get seriously ill. But the effectiveness of the vaccine seems to wane over time, and there are the many coronavirus variants to contend with.
You have two processes. One process is the disappearance of antibodies with the time, along with months. I mean, 6, 7 months, 8 months, you have to make a booster. On top of it, you have a new variant, which is more aggressive. And then you have to compete with two processes at the same time.
Israel was one of the first countries to start its vaccination campaign last December. About 60% of the population has been vaccinated by now, the vast majority with 2 shots. The sudden reversal is a critical test for the new government. Restrictions are back in force. Masks must be worn indoors, travel rules have been tightened, the unvaccinated are being urged to get their jab. The government is pinning its hopes on a third booster shot, although the effectiveness is still under debate. More than 1 million Israelis over 50 have already had a third shot.
People here in Israel are pro-vaccination. They know and they feel that it helped us in the first time. So they are willing to do it again. They are trusting the science behind it.
Israel's authorities are trying to strike a difficult balance, tightening restrictions while at the same time encouraging booster vaccinations in the hope of heading off a full lockdown.
Yair Lewis joins us now. He's an Israeli scientist and physician. Welcome to the program. Now, Israel was one of the first countries to successfully pull off a mass vaccination effort quickly, as we heard there. Is what is happening there a taste of things to come for other countries who followed its lead?
Well, I think what we've learned with COVID-19 that it's extremely unexpected, and you should prepare for the unexpected. But that being said, I think that trends have been similar in different countries, similarly to how Israel has perhaps followed the UK with the Delta surge here. So yes, it could be a pre-signal for other countries.
Can you tell us why Israel is experiencing such high infection rates despite widespread vaccination? Is it really just down to Delta?
So, like you said in the piece before the interview, there are actually two processes here going on. First of all, is Delta, and what most people think, most scientists think, is that's actually not the most important factor, but there probably is also a factor of waning immunity, and there's been a lot of talk about it lately. There's actually a very good paper that came out yesterday from Israel, which summarizes this data nicely, and it fits in with what we were seeing from the data coming out of the UK and the US. There was a paper published in the US also a few days ago that showed that vaccine effectiveness versus infection definitely wanes over time. But the important thing is, and this is what we're also seeing in Israel, is the effectiveness for severe disease perhaps goes down a little, but it is still very high, probably over 85 to 90% for most age groups.
Does this mean booster shots are essential for countries that are seeing infections like these?
That's an excellent question, Janelle, and probably the question that everyone is asking themselves. So first of all, I'd like to say that, for many vaccines, the regular schedule of the immunization protocol includes a booster shot. Let's say for hepatitis B, you get the vaccine, and then you get another one after a month, and then you get another one after 6 months. So this it is biologically plausible. Antibodies do go down, but obviously antibodies in the blood do not tell the entire picture, because B cells, memory cells, which are generating antibodies, still exist. But the bottom line is that booster shots may be needed. We would have to collect more information from what's going on in Israel right now, I think, to determine the effectiveness of the booster shot. What we're seeing in Israel right now is that after the booster protocol was initiated in the older people, the rate of severe cases started turning down, as opposed to the rate of cases in the unvaccinated population. What percentage of that is a behavioral change, as older people have realized that the surge is real and they need to be more careful? And what percentage of that is actually the effect of the booster? We're going to need to wait for more raw data and to be analyzed and published before that can be reliably said, I think.
Much to be determined, but what does this fourth wave in a widely vaccinated population like Israel's mean for the goal of herd immunity?
I think herd immunity, has been a sort of a catchphrase that has been used a lot and perhaps also misused a lot over the past year and a half. It's difficult to say what herd immunity means, because especially as said, new variants perhaps less amenable to or less susceptible to vaccines. To be honest, I don't know what it means for herd immunity, and I don't think anyone knows.
Right. Yair Lewis, thank you very much. Yair Lewis is an Israeli scientist and physician. Thanks for your time today.
Sure, thank you.
Up next, our science correspondent Derek Williams answers one of your questions.
What makes a pandemic a pandemic? COVID-19 is one, but the flu apparently isn't. Why?
This is pretty confusing, I admit. So maybe it's best to start with some basic definitions. The first term used in connection with the appearance of a disease, whether it's caused by a novel pathogen or by a pathogen we've seen before, is outbreak, which is kind of a catch-all description for any sudden rise in the number of cases. Outbreaks can happen in a particular geographic region, but they can also cross international borders. They can occur unexpectedly or intermittently, like, for example, Ebola outbreaks in parts of sub-Saharan Africa, or they can be regular occurrences, like seasonal outbreaks of flu. An epidemic, on the other hand, describes the situation when an outbreak expands and the disease begins spreading quickly to a large number of people, both within individual countries and across international borders. The SARS epidemic of 2002 and 2003, which was eventually contained after killing hundreds of people, is often cited as an example of an epidemic. A pandemic is what an epidemic turns into when it spins out of control, infecting an even larger number of people at an expanding rate and hitting populations globally, ratcheting up the number of deaths in a big way. Often that kind of wildfire spread occurs because the pathogen is a new one, or is maybe one that's reappeared suddenly after a long hiatus. So most people have never been exposed to it before and have no immunity. Flu pandemics do occur regularly. Just think of the one that killed between 50 and 100 million people worldwide over a 3-year period after the end of the First World War. However, that was caused by a novel flu virus that was quite different than the flu viruses circulating in populations at the time, causing normal levels of endemic flu. Those endemic flu bugs also cause disease, of course, and they also kill people, but mostly seasonally in different parts of the world and in relatively predictable numbers, which is what distinguishes them in epidemiological terms from, for instance, a pandemic-causing pathogen like SARS-CoV-2.
And that was our COVID-19 special. Thanks for watching. Stay safe and see you again soon.